I think it's a really good question, obviously, for large decision-making time for a lot of people. And it was always hard because I liked pretty much everything I did when I was a third-year med student and went through. But then I went back and really thought at the end what brought me the most joy, the patients themselves. And I love kids. And every day when I went home, even though it was a really hard day, I loved the patients. Happened to be that I really enjoyed my colleagues that I worked with as well, which was a great benefit, but that was probably the best way that I could make that decision, was really the patient care that I enjoyed. So, yeah. I think the long-term relationship, I'm a general pediatrician, so it is something I get to see people from birth till generally college age when they start going off, but it's, you know, a family dynamic that you have the experience to be able to come into and really experience people growing and learning and changing every day, and so it always keeps it interesting. But the patients themselves and the families are so responsive and really, you know, you get to have such a great relationship that it just makes it a wonderful experience when I get to go to work. What more, I guess, can you ask for? Yeah, I think, you know, this is one of the probably the most common questions that you get, and it's sometimes hard to answer because I think you need passion for what you're going to do. I mean, dealing with kids and sometimes in very difficult situations where they can have chronic illness and everything else means that you really need to want to do it. Hardworking always, I mean, and that's really for generally residents in all areas. Professional attitude, compassion, I think, respect, you know, just basic sort of things that show that you are going to be able to go through the next 3 years and not cause trouble. And really there to work, you know, to further your understanding in your professional career, and the start of a long road and journey that will continue for many, many years past your done residency. So that's probably the beginning part of some of the things you're trying to tease out when people come for an interview, which is not the easiest thing to do. But if people present themselves in a professional manner, no texting, no doing different things during the day, it's very helpful because then that helps to reinforce some of those attributes that you're looking for. I have a young family. I have 2 children. So I have right now a 16-month-old and a 3.5-year-old. And I've been married for almost 6 years. And in an academic career, I would say it's a little different. You know, my hours are sometimes a little different arranged than a full-time general pediatrician in the community. I work 5 days a week, plus at home. They work in the office generally, probably 3 days a week full-time, to 4 days a week is generally a full-time person. There, depending on where you go, you might do hospital rounding or see patients in the newborn nursery, things like that, so you can add that to your day. But that's the usual. I mean, I think the overall, because we obviously deal with kids, we're generally relatively family friendly, and I think it's one of the things where one day when you're looking at your job and really what you want, it's the next step of professional development, of being able to talk to your colleagues that you're working with and help to define your role. And obviously residency and fellowship potential of up to 6 years is a long time commitment, but that is something that in the end then you can say that's really what I wanted to do. And then sometimes people will work part-time even when they're, you know, a subspecialist, like a pediatric pulmonologist. They might work part-time even in that capacity so they have more time for their family. So it just kind of depends on what they're looking for. But there's definitely availability of having all those different options. And it's probably one of the most common things that we see when people graduate from pediatrics. We have a large proportion of women, and part-time is very highly sought after because people have families. think dealing with death in children is always extremely hard because it's not supposed to happen. And that's one of those things that, you work with others and you talk with other people that have dealt with it. And you do your best to try and help support the family and be there for them, because you can only imagine if it's hard for you what it's like for them. But that's probably that is the biggest challenge that I've ever dealt with in my career, have been the times that kids have died, and especially for those that have been in my practice. That's been something that is really difficult. But I know that at least it doesn't happen generally as much as it would if I was dealing with an older population. And my husband's a family practitioner, so I've definitely seen him have to deal with death in his patients, and don't think it's necessarily any easier. So it's the biggest challenge probably in medicine. I think probably the best thing that you can do is enjoy, play. It feels like, it should feel like work, but actually the more that you can engage with children, the more you will get out of them. And so having fun and being able to get down to their level and play with them when you're in the room with them, you will learn a ton. You can see their development, you can see their interaction, you can see their social skill. You're actually evaluating and examining them when you're doing that. It makes them more comfortable. The family will appreciate it, and you'll be a better doctor. And I think, that's the fun part probably of being in pediatrics, is the fact that you get to play when you go to work. But it's definitely one of those things that not everybody might think about, that I'm supposed to be not getting down and making funny noises or faces and things like that. And that's really actually one of the best parts of the job.